Hey guys, Dr. McClimon back with McClimon Chiropractic, and today we're going to talk about two of our favorite treatments to relieve pressure and pain from disc, bulge, protrusion, and herniation. So you guys, I'm sure have heard of those terms. There's different phases of herniation, bulge, protrusion, herniation, but no matter what phase you're in, it's creating pressure on your nerve because the disc is basically bulged out, impacting the nerve and what that nerve controls in your body. Our traditional approach, guys, is we check posture, we check balance, we take x-rays, we evaluate the structure. When there's a misalignment within that structure, that misalignment can create pressure on the disc, which can cause it to bulge and put more pressure on your nerve. So we make specific adjustments to those levels to realign the spine, which takes pressure off the disc, off the nerve, and allows your body to function properly without medications, without surgeries. So the specific chiropractic adjustment does help those things. One of the other treatments we found that has been very, very effective over the years is what we call flexion distraction. So this is a flexion distraction table. And what happens here is this is a little different treatment than the traditional adjustment. This focuses specifically on getting a disc bulge to retract and resorb back into its proper position. So when you have in a healthy spine, we have a disc and we have a nerve hole that's open and there's lots of space around that nerve. When you have a disc bulge, the disc bulges out, okay? In the worst case, the annulus ruptures, the jelly material sticks out, and it creates more inflammation and pressure around that nerve root, affecting that nerve and what it controls in your body. And yes, sometimes that's painful. So what this is a technique called flexion distraction where we lay you flat on your belly like this, okay? This table actually bends down, and when we do that, the disc bulge that you have in there, we open the space, okay? So when we open that space, it lowers the intradiscal pressure inside of that disc and gets that disc to suck back in. So we open it, we do flexion, it lowers intradiscal pressure and can get that disc material to resorb and suck back into the space, getting pressure off the nerve, really addressing the root cause of the problem rather than just masking with a medication or an injection. You know, those things can be effective symptomatically, but are they really addressing the root cause? No. So that's the difference. Surgery does address the root cause, however, it's more invasive. So this is going to be really your best conservative option prior to, going that surgical route. So if you've never tried flexion distraction or specific chiropractic adjustments and you've had, pain and disc problems over the years, highly recommend you check your spine. We check that structure. We can evaluate the MRI results to see the extent of it. And I'm going to say 95% of patients do get better with these treatments and don't have to have surgery. So if you're struggling, you've never had your spine checked, we highly recommend you do that. This is very effective, it's safe, and really can help get you out of pain and back to living the life that you love. So that's our tip for today, guys, and we look forward to seeing you on our next video. God bless.